So good afternoon. My name is Dr. Gregory Alfred. I am honored to speak to you guys. It's been a very impressive learning experience listening to all of the lectures so far, so thank you for indulging me. As far as my background, I am an emergency medicine physician originally from the U.S. Virgin Islands, and what really drew me into hyperbarics was my love for scuba diving. And during my residency, I had the ability to get trained in hyperbarics, and so when I finished training, I primarily was a hospital-based physician for the first 2/3 of my career, mostly doing ER shifts and covering hyperbaric shifts in the hospital. And one of the things that stood out to me was how limited conventional medicine is in its application of hyperbarics and many other therapies, of course. And so I had the opportunity about 7 years ago now to kind of transition to the outpatient setting, and I run a hyperbaric clinic locally that has a couple locations, one in Miami, one in Fort Lauderdale. And there, it's really allowed me to utilize hyperbarics to the full spectrum of conditions, not only treating disease, but also optimizing health. And more recently, I've had the honor of connecting with the Biohack Lab, and they're the ones who's responsible for our lunch. And if you guys ever want to try a soft chamber, we have one out in the vendors area. But as we've started to expand our offerings, one of the things we're looking at is a lot of these regenerative medicine therapies. And so it begs the question, how can we optimize these therapies? How can we make sure that giving these cells are actually going to have the intended effect? And hopefully by the end of this talk, you'll view hyperbarics as one of those things that we can do to help optimize the outcome. So first we should think about, well, what are the factors that influence success of stem cell therapy? I mean, first you need quality cells. So we're talking about the viability and the potency. I mean, the numbers you hear on a lot of these amounts of cells is in the hundreds of millions that are being injected. And in large part, that's because, especially if we're giving it intravenously, systemic, only oftentimes 1% of those cells are actually making it to the intended target often. So we really should do our best to optimize the efficacy of that whole process of homing and engraftment. So you need potent, high-quality product, you need an optimized host and microenvironment, and you need to continue to support that patient after the infusion. And hyperbarics can do all of those things. So, you know, there's this strategy called priming, homing, and protecting. And this is a great framework of thinking about almost anything that you would build around a regenerative medicine therapy. But specific to hyperbarics, the priming piece is that just one treatment in a hyperbaric chamber is going to, at the right pressures, double the amount of endogenous stem cells in circulation. And not only increase the number of stem cells, but it's going to modulate their secretion profiles such that a lot of these cues for homing, getting the cells to go to the right place, are going to be optimized. So not only is the system primed for these cells, but also the cells go to the right place. And longer term, if you continue to treat the patient after, we can continue to make this microenvironment more hospitable to the cells. So for those who may not know what HBOT or hyperbaric oxygen therapy is, we'll quickly run through that. So the governing body's definition, the Undersea and Hyperbaric Medical Society, is that it's inhalational therapy using 100% oxygen within a pressurized chamber. So, the name breaks it down even further. Hyper is increase, baric is pressure. We know what oxygen is. But this definition is actually outdated, and I'll show you later that 1.4 atmospheres, we see therapeutic effect at even less pressures than that. So why would you incorporate pressure in the first place? So based on physics, we know that as a patient is breathing a gas while they're under pressure, the amount of that gas that's dissolved in the tissues can increase. And on a more simple level, there's been these observations for centuries, if not millennia, that the Dead Sea, which is the lowest place on Earth, which is the highest amount of pressure and therefore more oxygen in the atmosphere, has long been associated with health benefits. We could think of this as like the original wellness spa, the Dead Sea. Whereas contrast that to Mount Everest, the highest place on Earth, a third of the oxygen, a third of the pressure, not hospitable with life long term. Most of us aren't going to go to Mount Everest, but we're all going to fly, and most airline cabins are pressurized to 8,000 feet, which is 0.75 ATA. So that's less PaO2. So I think this is a large part of why people don't feel so great, especially with a lot of travel. So as far back as the 1600s, this observation was made that if we put patients in pressurized chambers, they're going to, in general, do better. And this was before oxygen was even identified or truly discovered. And in the Industrial Revolution, during the building of these large bridges where these workers would develop a syndrome known as the bends or decompression sickness, hyperbaric chambers were used to treat them. And in the early 20th century, there was a physician and internist, Dr. William Cunningham, who made the astute observation that during the Spanish flu pandemic, at higher elevations, mortality was much worse than sea level. And so he then took that hypothesis to say, well, let me treat them in a hyperbaric chamber and see if the outcomes are better. And they were so successful that he was able to build this, what probably still is the largest hyperbaric chamber ever constructed. It was basically a hotel where people would go. But back then, there wasn't really much elucidation of the mechanisms. It was just kind of this simple observation of, okay, people seem to do better, but not a big understanding as to why. But fast forward to today, the tech has expanded dramatically, and our understanding, more importantly, of what's happening has also expanded. So a more updated definition would be that, most people think of hyperbarics as helping with wound healing, but the way it exerts its wound healing effects is really, it's a pressure and oxygen dose-dependent biologic repair gene therapy. So mouthful, but basically it interacts on genes. So it will turn up the trophic or the regenerative genes, turns up anti-inflammatory genes, and turns down pro-inflammatory and apoptotic genes. And which genes are affected depends on these different combinations of pressure and oxygen. So really epigenetics is the core mechanism of how it exerts its effects. And again, the antioxidant genes get upregulated. We've heard a lot about BDNF, VEGF during this conference. These are all very important to optimizing the microenvironment for regenerative medicine therapies. Hyperbarics turns these things up and inflammation gets turned down. And what's compelling about a lot of these changes is that somewhere between 30 and 40 treatments, this becomes the new epigenetic set point. And that can be much more durable. There are studies that have shown up to 2 years that we still see these epigenetic changes after a protocol of 40 hyperbaric sessions. So lots of different chamber types. The top left is my center in Miami. The top right is Mercy Hospital's multi-place chamber, so they actually are able to fit 4 people in there somehow. The bottom right, you recognize that from the vendor area, the Biohack Lab soft chamber. And so it's helpful to kind of review some of the mechanisms of hyperbarics. We know that the way we deliver oxygen under normal circumstances is using the hemoglobin molecule, and it binds with the blood in our lungs and gets taken out to the cells, and then the mitochondria are the primary utilizers. So those with normal lungs are pretty much close to full saturation for this oxygen delivery chain, meaning you just put someone on oxygen, they're not going to get much benefit. So it's really by adding in pressure that you utilize a new medium for delivering oxygen, which is plasma. So plasma, speaking to you now, all of us, only about 2% of our total oxygen is dissolved in plasma. When you get into a hyperbaric chamber, that number goes well above 20%. So, and it's really by dissolving oxygen in plasma, it's very simple. An oxygen molecule is much smaller than hemoglobin-bound oxygen red blood cell. So it's able to transmit about 4 times further, deeper into the tissues, resulting in 1,200% increase in tissue oxygenation. All right, so that's how, but then the next question is, all right, so what's the implication of supraphysiologic oxygen? What does it do for us? It's best thought of in a dichotomy between short-term and long-term. So in the short term, there's a bunch of things that happen, but they're really transient, probably about 24 hours worth. But with a repetitive protocol, you do get some more durable changes. So in the immediate short term, now this is what would be influencing the concept of priming the system and homing. You see raising in oxygen, decreasing in swelling and inflammation. You get a major stem cell release, which I'll expound upon. You get improvement in mitochondrial function, immune system function, lymphatic drainage, even autonomic nervous system. But specific to stem cells, hyperbaric regulates stem cell biology, and just one treatment in a hyperbaric chamber can cause mobilization and recruitment of progenitor stem cells from the bone marrow. It stimulates their proliferation and differentiation. It also modulates their secretion profile such that the homing process of chemotaxis, adhesion, migration to sites of injury are all optimized. And so we have studies that show, let me actually go to this next one. So we know that at 2 atmospheres for 2 hours, that we can see a doubling of stem cells, of endogenous stem cells in circulation. If you treat someone for 20 sessions, that number is up to 8 times as many. Now, what about the soft chamber that you see out in the vendors area? So it used to be thought this was dismissed, and still is dismissed by a lot of people in the conventional hyperbaric world, as this is not real. However, this study that came out just earlier this year showed a 3-fold increase in stem cells 72 hours after completing 10 sessions in one of those chambers, only using air, no supplemental oxygen. So this is pretty compelling for lots of reasons. First of all, it means that it expands access, because not everyone has access to medical grade hard chamber hyperbarics. And so if you could convince a patient to do 10 sessions before, you can be confident knowing that there's a good chance there's double, triple the amount of stem cells, their own endogenous cells in circulation. And the other thing it really makes me think about is that most of the studies looking at hyperbarics, one of the biggest challenges is trying to create a placebo, right? Because you can't truly blind someone to whether or not they're being pressurized. They always feel it in their ears. So what the studies have often done is they'll use 1.3 atmospheres as a placebo arm, and then they'll have a treatment arm. But as we can see here, 1.3 is not a placebo. I mean, it's actually doing something. So the fact that many of these studies have not shown statistical significance in the difference between the groups is probably just because of study design, not because hyperbarics doesn't work. So we know that the more pressure, the more oxygen raising, and then in fact, the more stem cell mobilization. So the idea of protecting the system, the same things that would prime the system are also going to protect the microenvironment to really improve cell survival, also known as engraftment. So we're talking about circulation, inflammation, oxidative stress, even metabolic health. So working on the soil to optimize these transplanted seeds or cells. So inflammation, everyone knows how deleterious it can be. Interestingly enough, we need some inflammation for the whole chemokine gradient. So you wouldn't want to wash it out completely, but that's why many of the protocols that are designed of using hyperbarics would be 1 or 2 sessions prior to the regenerative medicine therapy. And we see it's on par with a lot of these conventional pharmacologics, whether they be biologics or steroids, without any of the downside. And we also see an increase in antioxidant capacity. So I try to avoid busy slides, but the reason I put this up is that after 1 session of hyperbarics, a lot more oxygen is given to the mitochondria to work within the Krebs cycle, and you get net increase in reactive oxygen species. So one treatment can oftentimes have a slight rise in oxidative stress. But starting from the second consecutive treatment, you get all these compensations through sirtuins, through FOXO, through PGC1 alpha, HIF1 alpha, and then all of these free radical scavengers that get upregulated, superoxide dismutase and the like, so that your net oxidative stress goes down. So this is why when people hear about hyperbarics and come to me for a consult and they say, oh, why don't I just get in once a week, once every month? All they're getting is the oxidative stress piece without the adaptation. So it does require consecutive exposures to this environment to really capture all of the benefits. Angiogenesis, improved microcirculation, is a massive benefit, and this is how, in the conventional world, how we're able to help diabetics avoid amputation in some of their non-healing wounds by improving the microvasculature. But as you can imagine, if you're going to improve the microvasculature in the toes, you're going to do it in the brain, in the cardiovascular system, in the dermis, et cetera. So something that's widely applicable. And so that's going to be a big part of the protect strategy. If you improve the microcirculation, now the environment that these cells have been transplanted and infused into are going to be, the survival is going to be that much better. And so both by optimizing the mitochondria, the metabolic health, the oxidative stress, and the circulation, this is how, now you do need several sessions for these benefits to be more durable, and so that can be anywhere from 10 to as many as 60 sessions. As far as the data, we have kind of a mixture of both animal and human models. You don't see large studies being funded by hyperbaric chamber manufacturers. So much of the data is on the preclinical scale, but there is some human data as well. So this study looked at spinal cord injuries in animals and rats, and they treated the rats with hyperbarics for 14 days at pretty shallow pressure after intravenous stem cells, and they saw improved motor recovery, And these are the different pathways that they implicated. We see the same thing in an osteoarthritis animal model, higher pressure, but also treated the animals for 2 weeks with better outcome. And we see the same thing in limb ischemia. And so, we can safely conclude looking at that, there's plenty other studies as well, that the combination consistently outperforms monotherapy in multiple disease models. So it makes sense to not only pre-treat somebody with hyperbarics, but continue to treat them after. And these are some of the different pathways that are implicated. So we know that based on this data, we could say that it likely helps protect these transplanted cells, enhancing their viability and their efficacy. A lot of human data comes actually from hematopoietic transplanting, using hyperbarics to precondition these patients before transplant. And you see some similar things, improved kinetics. And the lower erythropoietin, we know, can be applied to not just hematopoietic transplant, but also mesenchymal cell transplant, because that's associated with better engraftment. Another study showing the same, also basically the same thing. And we've got human data. It's gradually increasing and improving the amount of human data that we have. There were studies looking at using hyperbarics and stem cells to treat type 2 diabetes, post-MI, and post-traumatic brain injury. But we still have lots of gaps in the data. We don't really know what's the optimal dosing, timing, which indication is really ideal for this. And we do have some active studies going on, active randomized controlled trials to hopefully give us a better understanding. But based on the current evidence, what would be the most evidence-informed protocol? As far as timing, ideally you're going to do a single hyperbaric session at least within 24 hours of the infusion. And because there does appear to be this window of time in which that's really going to assist with homing. And as far as the pressure, anywhere from 2 to 2.4 HCA would be my preferred pressure. But again, as I pointed out, if the only option is a soft chamber, you're still going to get benefit, but you just have to do more sessions in the soft chamber. And then post, in order to continue with the protection of these cells, you're going to do daily hyperbarics. Minimum, I try and get patients to agree to is 3 after, but those who are really kind of all in on leveraging all of the benefits of hyperbarics, they'll do 40, even 60 sessions. And there's compelling evidence for even absent stem cells for doing a long protocol of hyperbarics, of what it does for longevity, just overall health, etc. So take-home message, we do have lots of evidence that points us in the direction that combining these therapies makes a lot of sense. Timing matters, and there's this whole sequence of the idea of priming the body and then assisting with homing of the cells to get them to where we want to go, and then protecting the cells where they're there. We've heard a lot this weekend about lots of different variables that can optimize these therapies. So we've heard about voltage, which I found fascinating. We've heard about hormone optimization. We've heard about the importance of nutrition and avoiding inflammation. I think we're going to hear about photobiomodulation. So all these things are ways, these therapies, regenerative medicine therapies, are not cheap. And so we really have to, I think, not only, of course, we want them to be more efficacious, but I think there is a bit of the psychology as well for the patient receiving these therapies to just not feel like, they paid thousands of dollars just for an IV. It's more building a package, and it's not smoke and mirrors, it's real. These are things that are going to improve the efficacy of the therapy. So hopefully that makes sense.